Welcome to Ortho Reports, where we break down the latest research for you. If you've ever had that nagging shoulder pain, you know how frustrating it is. You do all the exercises, you go to physical therapy, but sometimes it feels like a total roll of the dice whether you'll actually get better. But what if it wasn't random at all? What if there was a hidden angle, a simple measurement of your own bones that could predict who recovers and who doesn't? Well, today, we're diving into a study that found exactly that.
So, this is the big question, isn't it? It's the central mystery. Why does the exact same treatment plan work wonders for your friend, but maybe it does nothing for you? For years, this has puzzled clinicians and researchers. But it turns out the answer might have been hiding in plain sight this whole time, on a simple X-ray in the very shape of our shoulders.
And we're not talking about some rare, obscure condition. A staggering 48%, that's nearly half, of all shoulder pain complaints are because of one thing: shoulder impingement syndrome. So figuring out who's going to respond to treatment is a huge deal.
Okay, so what is shoulder impingement syndrome? The easiest way to think about it is like this. Imagine the tendons in your shoulder have to pass through a tight, bony tunnel. With SIS, that space just isn't big enough. So every time you lift your arm, those tendons get pinched or rubbed. And that constant compression leads to pain, inflammation, and makes even simple things like reaching into a cabinet feel totally impossible.
This brings us right to the heart of this fascinating study. Researchers started to wonder, hey, what if the problem isn't just the tendons? What if it's the actual shape of the bony tunnel itself? They had a hunch that one specific anatomical measurement could be the key to this whole puzzle.
And that measurement is called the critical shoulder angle, or CSA for short. It's a pretty simple angle that you can measure on an X-ray. It basically looks at the relationship between your shoulder socket, that's the glenoid, and the bony roof right above it, which is called the acromion. A larger angle means that roof juts out a bit more, and you can imagine how that might create a tighter, more problematic space for those poor tendons.
So this led them to a really clear and testable hypothesis. They predicted that people with a smaller angle, less than 40 degrees, would probably have more room in there and would respond really well to physical therapy. But for those with a larger angle, over 40 degrees, they might have a structural issue that rehab alone just can't fix.
All right, you got a solid hypothesis. What do you do next? You put it to the test. So they designed a study to follow actual patients with shoulder impingement to see if this angle really could predict their recovery in the real world. Here's how they set it up. They took 40 patients and split them right down the middle into two groups. Group A had that smaller, supposedly good angle of less than 40 degrees. Group B had the larger, supposedly problematic angle over 40 degrees. And this is the most important part. The only significant difference between these two groups was this one single measurement of their anatomy. Now, to make sure it was a fair comparison, every single patient, no matter which group they were in, went through the exact same standardized 12-week physical therapy program. This is so important because it means any differences in the results couldn't be blamed on the treatment they received. It was a pretty standard approach. Started with pain management, moved into stretching and posture, and then finished up with strengthening exercises.
So for 12 long weeks, the researchers carefully measured everyone's pain and function. And when they finally sat down and crunched all the numbers, well, the verdict was pretty undeniable.
Okay, let's look at the data. This table shows the Oxford Shoulder Score. It's a way to measure shoulder function, and a higher score is better. Now look at the before rehab row. Both groups start in basically the same place, right? 16 and 14, pretty much identical. But just watch what happens. By 6 weeks, a little gap starts to appear, and by the end, at 12 weeks, that gap has turned into a canyon.
And this bar chart makes the final result crystal clear. Group A, the folks with the smaller angle, they finished with a fantastic functional score of 39. But Group B, the larger angle group, they were lagging way behind at 32. This difference was statistically significant. It wasn't a fluke. The hypothesis was spot on. The shape of their bones truly predicted their path to recovery.
So this is the really crucial part. What does this all mean for someone who's actually suffering from shoulder pain? Well, this research is a huge step away from a one-size-fits-all approach and moves us toward a much more personalized and predictive way of treating people.
Let's break down the key learning points from this case. First, this critical shoulder angle is a really powerful predictor of who's going to do well with standard physical therapy. Second, this lets doctors personalize treatment right from day one. They can now see that patients with a smaller angle are perfect candidates for this kind of program. Third, and this is huge, it helps manage expectations. If you have a larger angle, your doctor can tell you up front, hey, this might take a bit longer, or we may need a different approach down the road. And the best part? All of this incredibly useful information comes from a simple, inexpensive X-ray. This leaves us with a really powerful final thought. Sure, this study was about the shoulder, but the principle behind it is so much broader. By looking for these hidden anatomical markers, could we use simple diagnostic tools, like an X-ray, to predict outcomes and personalized treatment for all kinds of chronic pain? It really seems like we're just scratching the surface of how our own unique anatomy shapes our path to recovery. Thanks so much for joining us for this summary. We'll see you next time on Ortho Reports.